Awesome. Well, good morning, everybody, and welcome to our Tuesday morning or Tuesday afternoon, wherever you are, Impact Health educational webinar. My name is Lauren McQueen. I am here with my co-host, Mr. Jeff Street. We have an amazing special guest on here who's going to bring some really awesome news to everybody. But for those of you, if this is your first Impact Health webinar, welcome. We do these every single Tuesday at 11 a.m. Central, 12 p.m. Eastern, where we do a deep dive into all things Impact Health. I know we have many people on this call. Maybe someone got you a quote this week and you are looking to learn about it, learn about impact plans for yourself or for your family. We have doctors on these calls seeing how can they partner with Impact Health, become preferred providers. We have business owners on this call learning about our plans to potentially offer this to their employees. So we have all different types of people, but you're going to get a load of information today. So if you want to be in a place where you can maybe screenshot or take some notes, I will be posting this recording, and I'll show you in a second where you can get that recording. But if you have any questions over the next 45 minutes of this webinar, please post your questions in the chat, because at the end of this webinar, we're going to go through those questions. We'll be responding, to you in the chat as we go. But for the questions that we think people really want to hear, we'll actually be verbalizing them and answering them in front of everybody. So with that said, let me introduce myself. I've been an entrepreneur my entire life. I know we have lots of self-employed people on this call as well. And although there's so many blessings to being self-employed, no one's covering my healthcare, right? So for the longest time, I went without health insurance. I went without coverage because as a healthy individual, it just didn't make sense for me to pay the crazy amount of money I was going to have to pay going through traditional insurance. My husband is a business owner. He owns a roofing company, little plug to Priority Roofing. And he was not able to offer healthcare to his employees prior to learning about Impact Health. So we learned about Impact Health just under 2 years ago, and we're blown away, not only with the quality of the coverage, but with the pricing. So we got ourselves a quote. We got on a plan for just over $300 for the two of us. He's now able to offer this to many of his employees. It's been such a blessing. But for those of you that are tuning in for the first time, you may not be familiar with what health sharing is. So that's why we're going to dive into the differences between health sharing and traditional insurance, and then also dive into, of course, some specifics with Impact Health. But just so you know, health sharing is a nonprofit alternative to traditional health insurance, and there are so many benefits of it. So let me go ahead and dive right in. First thing I do want to share with you is our Facebook group that we're going to be posting this recording in. Okay, so feel free to scan this QR code or just type in Health Share Crusade Community on Facebook. And this is where we're going to post the recording, as well as you're going to get a lot of other information that's already posted in that Facebook group. Lots of amazing testimonials. People ask questions in there. It's a really good group to be part of. But let's talk about the healthcare industry right now. I know many of you on this call would agree with me when I say that the health insurance system needs a lot of help right now. In many ways, it is very broken. And so what we have with Impact Health is we are disrupting that broken industry. And so just some truths about healthcare. The average individual in America paid $780 per month, and the average family paid just over $2,000 per month for marketplace insurance in 2022. And in 2019, I know this number has increased in the last 5 years, but in 2019, 59% of bankruptcies cited medical expenses as a major factor. And I believe it's almost 70% now in 2024. 80% of our country is trying to lower their healthcare costs. I know that's not a surprise to any of you guys on this call, but 5% of the population is responsible for 50% or more of the annual healthcare spending costs. And that just says that people are overpaying for their healthcare every single month. Over 100 million Americans, this number just blows me away every time. 100 million Americans are in some form of healthcare debt. So what are people looking for? Number one, affordable monthly premiums. If you have health insurance, chances are over the last few years, your premium has gone up. We hear it all the time. Affordable copays people want, affordable deductibles. People want to be able to choose their doctor, choose their facility that they go to, not have to worry about being confined within a specific network. And employers, like my husband, like many of you on here, want to be able to offer healthcare as a great benefit to your employees, but doing so at an affordable cost, right? So let's talk about health share programs in general. So health sharing programs are not new. They've actually been around for over 40 years. And so health sharing actually originated in churches 40 years ago, where church members would pay into or share into each other's medical bills. And so we have adapted that concept now, and that is what we have with Impact Health Sharing. As an Impact Health member, your monthly payment that you're paying is literally sharing into other people's medical expenses and vice versa. But I know a lot of you on here are familiar with HealthShare. Some of our other, health share companies out there like Christian Health Ministries, Samaritan Health, MediShare, Impact is a little different. Number one, it is the most modern and contemporary health share company out there. A lot of other health share companies, you pay up front as a cash pay member, but the way that Impact is designed to work is providers bill Impact electronically. It feels like traditional insurance. Impact also negotiates the price of your medical bills on your behalf. Many health share companies out there, you as the member are responsible for negotiating those medical bills, responsible for just paying as a cash pay member using a cash pay discount. But trust me when I tell you, Impact will negotiate those bills much deeper than that cash pay discount. And then I love the fact that anybody can be an Impact member. You see, you don't have to prove to be affiliated with a church or a certain religious belief. Anybody can be an Impact member. And so right now we are helping individuals, families, and small businesses save anywhere from 30 to 50% per month as compared to traditional insurance. And I talked about how Impact negotiates medical bills on your behalf. So if you're taking notes, write this number down, because Impact on average negotiates and reprices medical bills on an average of 72% less than what that medical bill originally cost. I've experienced that personally. Since being an Impact member over the last 2 years, I've, kid you not, been in the ER 3 separate times. And thank God for Impact, because the Impact has saved me thousands and thousands of dollars, probably close to $10,000 with the way that they reprice medical bills. And so diving into specifics on Impact, it is comprehensive medical care, small events, large events, preventative, everything. And you have nationwide access to all networks. This is so important because, number one, if someone, God forbid, gets diagnosed with cancer, any other illness, you can go to the MD Andersons. You can go to the best possible facilities to get the best possible care. In my instance, when I was in excruciating pain at 1:30 in the morning, I could go 8 minutes up the street to the nearest ER, not having to worry if they were within my network. Impact offers unlimited telemedicine. So if you don't want to go into the physical doctor's office, you can have a virtual conversation, video call, phone call with an actual doctor, completely free, 24/7 access, and unlimited visits for every member of the family. We have phenomenal prescription pricing, and our plans start as low as $73 for individuals and $378 for families of 3+. I had a phone call with someone yesterday. She said, my husband just quit his job. We have a family of 4. We were quoted $2,300 with traditional insurance. I gave them a quote for just over $600 with our lowest deductible or primary responsibility amount. Speaking of deductibles, we don't use that word. We call it primary responsibility amount. You'll see PRA, same thing as a deductible, but get this, it is a household deductible. It is not an individual per person deductible. And those household PRAs start as low as $2,500 for the year for the whole family, whether you have 2 people in your family or 12 people in your family. It's awesome. We talked about how Impact is a nonprofit alternative to health insurance, and it's available for migrants. So for those that have an ITIN number and a legal form of ID from Mexico, Guatemala, Canada, or the US, they're able to become Impact members. One of my favorite benefits of Impact is our health and wholeness credits, where if you show that you have proof of payment to maybe you have a gym membership, You take supplements and vitamins like I do. You like essential oils. You go to a naturopathic doctor, or you take a holistic route. Well, you can submit proof of payment for those different services, and Impact will credit your PRA or your deductible up to $100 every single month. My naturopathic doctor costs me $265 a month. I submit my invoice into Impact, and every single month I'm getting $100 credit. That's $1,200 a year, saving me towards my PRA. And then lastly, everyone's been waiting for this announcement, but coming in the next week, dental and vision discount cards will be released. We have our Vice President of Operations with Impact Health, Eileen Ryan, on the call. She's going to be sharing more about this here in a little bit. But who is our target customer base? Individuals and families who are overall fairly healthy, who are currently paying some or all of their healthcare costs, is Impact's target customer base. And honestly, 91 million people in America fall into these three categories. Non-group companies, so we work with small businesses, companies with 49 employees or less, those that are self-employed like myself, like many of you on here, independent contractors, gig or part-time workers, and then obviously those that are underinsured or those with no insurance at all. And so I get this question often, and they ask me, Lauren, tell me about pre-existing conditions. Will my pre-existing condition cause my monthly payment to go up? The answer is no. Will my pre-existing condition disqualify me from being able to becoming an Impact member? The answer is no. And so our definition of a pre-existing condition is anything in which known signs, symptoms, testing, diagnosis, treatment, or use of medication has occurred within 36 months, so 3 years prior to becoming an Impact member. So on that same phone call I've been referring to, this lady yesterday, she said, my husband got in a really bad car accident a year ago, broke his back. He's been totally fine for the last, 8 months or so. Can he still be an Impact member? The answer is yes, he can still be an Impact member, but because that accident happened within the last 3 years, all the medical bills associated with that accident would be considered pre-existing. So with a pre-existing condition, with medical bills associated with those pre-existing conditions, the beautiful thing, Impact Health will still negotiate those medical bills down. So remember I said on average, they're negotiating medical bills down by an average of 72%. Those bills will still get repriced on your behalf. The only difference is medical bills associated with that pre-existing condition will not count towards reaching the household PRA or the household deductible. So we like full transparency here. And I say, if you have, maybe you're currently covered by traditional insurance and they are covering very expensive prescriptions for you, or you have to go and you get procedures often and you have a lot of medical expenses, Impact Health might not be the best fit for you, but for the majority of people who are overall all fairly healthy, or you do have pre-existing conditions, but they're controlled and there's not a lot of medical bills associated with it, Impact is a phenomenal option for you. And I love the fact that high blood pressure and high cholesterol will not be considered pre-existing for purposes of determining eligibility if you have a future cardiac or a vascular event. I know many people who are very healthy that have high blood pressure and high cholesterol. So we're going to post the guidelines, if they're not already posted, the Impact Health guidelines in the chat. And you guys, I encourage you, when this webinar is over, open up the guidelines, read through everything. It is so transparent, and it also specifically talks about pre-existing conditions. Let me just give you one example. This is one of my husband's employees. He lives outside of Denver, Colorado. He went to the hospital back in September of last year, and he actually had blood clots in his legs. And this was something that had happened and occurred within the last 36 months of him being an Impact member, becoming a member. So this was actually considered pre-existing. But his medical bill was $5,751. When Impact received that bill, they looked at the cost of that medical bill and they said, this is not the fair market value. In other words, this is not the standard rate for those procedures and that treatment he got. Impact repriced those medical bills, and they repriced it down from $5,751 all the way down to $620.53. You guys, they saved this man $5,130.75. It's unbelievable. So he paid his $620. Now, because this was pre-existing, the $620 did not count towards his household deductible or his household PRA. Had it not been pre-existing, then of course it would have been applied to that. So I hope that made things a little more clear for you. But what I'm going to do right now, I'm going to get myself out of the way. I'm going to introduce my co-host. We do these calls, like I said, every single week. I love learning from him. He's taught me so much that I know about impact, and he's an expert when it comes to impact health. He's helped literally thousands of people get affordable, quality health care. And with that said, I'm going to turn the call over to Mr. Jeff Street.
Well, Lauren, thank you so much. What an amazing job you did kicking off the call here today. How many of us can just feel Lauren's passion, her excitement, or her enthusiasm with what's happening here with Impact Health Sharing? So let's give her a virtual round of applause. And, Lauren, thank you for being a crusader for the community here. I know that one of your missions is to really go out and be on a crusade to disrupt what many of us believe is a very broken healthcare system. And this is so exciting here today. Welcome to learning about the fastest growing healthcare sharing company in America, Impact Health Sharing. We're about to hit 500 participants on today's Zoom. This is the biggest Tuesday Zoom that we have ever had. Matter of fact, I don't even know if we can fit more than 500 attendees here. We're about to find out. I think we're going to max it out. But guys, my story, I learned about Impact Health Sharing a few years back. I'm 45 years old. I've always had my own business. I've worked for myself since I was 19 years old. And I believe one of the biggest pain points in being an entrepreneur is health insurance. And for my first handful of years as a business owner, look in my 20s, I opted out of having healthcare. I couldn't afford it. I thought nothing was going to happen for me. And as I started making a good income, I said, well, I probably should have it just in case. And for years, I spent a lot of money on healthcare costs. When I first was introduced to Impact Health Sharing, my wife and I, we had one of the biggest commercial insurance companies in this country. We had a high deductible plan because we're healthy people to try to drive our price down. Matter of fact, we each had a $7,500 deductible, each of us, for the two of us, and we were still paying right around $1,000 a month to have health insurance. When we first learned about Impact, the first thing that we saw was it was something that was going to save us just under $8,000 a year. Now, how many of you that would get your attention like it did for me? And so I got really cautiously optimistic, if that makes sense to some of you guys. And as I started to dive in and learn some of the things that many of you are going to learn here today, this went from a way to save money to something that today I just believe in every single fiber of my being, of something where we can do some amazing things for so many people. And I'm going to share with you some of those things today that I found out about over the last few years. It's made me so passionate about what we're doing here. And then you'll get to hear from the Vice President of Operations of Impact, Mrs. Eileen Ryan, which is going to be very exciting. But let me first talk about how do you get a quote? It's very simple. Many of you are on the call. Maybe you haven't gotten a quote for yourself. Whoever introduced you to this call here today, they're a referral partner with Impact Health Sharing, and they have their own referral partner link that looks just like what you're going to see here today. And all you need to do is actually take their link and actually put in the date of birth of the oldest person in your family. So let's say it's March 30th of 1989. This link here belongs to the Texas Chiropractic Association. I know many of you on the call today were invited by those guys, but whoever invited you on the call, they have a link that looks just like this. And make sure you go to their link to be able to get your quote. So again, all you need is the date of birth of the oldest person in the family and the number of people that are in your family. So let's say it's March 30th, 1989, and it's a family of 3+. Now, whether that's a family of 3, 4, 5, 6, 7, 8, 9, the price is going to be the same. So it's just one person, 2 people, or 3+. So I click on Get Quote, and within seconds, as you can see, a quote gets generated for this family. Now, for every quote, there's going to be 4 different options. Now, nothing is different about any of these options other than 2 things. Here's what they are. Number 1, The primary responsibility amount that you choose, like Lauren said, that's like a combined family household deductible. And then the standard rate that you pay, which is just like what your monthly, just like having a monthly premium with an insurance company. Now, the lower the PRA that you choose, the higher your standard rate is going to be. The higher the PRA that you choose, the lower the standard rate is going to be. People ask me, well, what's best, Jeff? Well, what's best is what you think is best for your family. For my wife and I, we have a $2,500 PRA for our entire family. Now, remember, we used to have a $7,500 deductible each of us. So that in itself, we believe is really amazing. So for this family, if they chose the 2,500 PRA, their monthly standard rate would be $576 a month. If they chose the $10,000 PRA, you see their rate would be $404. So let's break this down a little bit. So as a member, you're responsible, you and your family, for meeting that PRA, that primary responsibility amount. Now, as Lauren mentioned, Impact will still negotiate your bills on your behalf, even before reaching that PRA. Once you've reached your PRA, sharing now kicks in. Now, in the insurance world, many of us know terms like having an 80-20 split or a 70-30 split. This is very common in the insurance world, where many times once a family or an individual hits their deductible, then the insurance company will cover 70 or 80% of the medical bills, and then the insuree would be responsible for 20 to 30%. So Impact has something called co-sharing. And here's what that means. That means once you've met your PRA, the community, which is all of us and a whole lot more people, the community will share into 90% of your eligible medical bills. You'll be responsible for 10%. Now, the most that a family could ever pay per year in co-share, think of this like a max out-of-pocket expense, is $5,000 for the year for the entire family. So if the family ever meets that $5,000 number, now the community will share in 100% of the eligible medical bills for that family. And remember that co-share, that max out-of-pocket expense, is for a whole family combined. Now, let's just look at one more example. Let's take that family of three and let's just make it one single individual that's 35 years old. We click on Get Quote, and you can see $102 a month to $246 for that individual. Now, once you get your quote with what you learned here today, some of you are just going to be ready to enroll. And what's exciting is there's no open enrollment with Impact. Your Impact membership will begin the first day of the next calendar month. So if you want to have an October 1st start date with Impact, you just need to make sure you complete your membership enrollment by Monday, September 30th at 5:59 Eastern Standard Time. Now, on the bottom here, if you're like, I have more questions, we're going to answer some of those questions today, but you may still have some more. So if you have questions still, all you're going to do is just submit yourself in as a lead. Name, email, phone number, click on Learn More, and somebody from Impact Health Sharing will text message you and email you a calendar invite to schedule a time to have a call with you, answer any of your questions. And if you like what you hear, they'll refer you back to your referral partner's website where you can go out and complete your enrollment and you can get your Impact membership started. Now, let's go over a few other things here. The next category that I want to talk about is for individuals that are 65 years or older. Now, this is something that's a very important topic right now because for our great seniors in our country, they're going through something called open enrollment. I know Eileen's going to talk a little bit more about that, but we have a program for seniors. As long as a senior has Medicare Part A and Part B, they can replace their supplemental plan with Impact for Seniors. And here's how that works. There's no such thing as a pre-existing condition for a senior in Impact's world. So as long as that senior has Medicare Part A and Medicare Part B, Impact will share in everything that Medicare Part A and Part B doesn't cover for the senior. Now, if the senior also has Medicare Part D, Impact will also share into their prescription cost as well. Now, on our senior plans, the pricing ranges from $96 a month to, I believe, $140 a month, depending on the age of the senior. And for a senior, their PRA, their personal responsibility amount, is $1,000. So they're responsible for that first $1,000. And then again, Impact will share in everything that Medicare Part A and Part B does not share into. Now, we also have a lot of plans available for businesses. This is really trending right now. Listen, right now, a lot of small business owners are getting their insurance renewals for the year. And what many of them are seeing is an 8 to 25% price increase. Matter of fact, most of the other healthcare sharing companies are also doing a price increase this year. Not only is Impact not doing a price increase, but you're going to learn today, they're giving more member benefits for us, the Impact community. But for small businesses, our target market is businesses for 49 employees and less. On average, we're helping businesses save 40 to 50%. For small businesses, many of them are having to opt out of offering healthcare this year because they can't afford the cost. Impact can allow them to attract a better quality employee and also retain employees by being able to offer something of value to their employees. So for business owners, you can submit yourself and as a lead, and Impact will get you a quote for your entire company. And if you like what you hear, they'll even do employee education webinars to help your employees get educated about Impact Health Sharing. So let's talk about the member experience. This is what an Impact Health Sharing membership card looks like. Let's go over this a little bit. First off, one thing that's important to know is all Impact members get a free physical and a free annual wellness visit for every member of the family. Impact members also get a $150 annual blood work credit. Here's something I love. You'll see an example of this in a minute. Outpatient therapy, which consists of chiropractic adjustments, occupational therapy, physical therapy, respiratory therapy. Impact members get $50 per year per member of the family, where there's no provider fee, which is like a copay associated with those visits. That's huge. $50 per member per family. My wife and I get adjustments regularly. Also, telemedicine through MD Live. It's unlimited 24/7. It's free. Phenomenal service. Their response time and calling back on a teledoc appointment is under 20 minutes. Office visit, it's $50. Once you've already used your annual wellness visit, you have a $50 provider fee, which is like a copay if you have an office visit. Urgent care, you can see, is $75, ER and inpatient is $150, and so on. But let's talk about the back of the card. As Lauren mentioned previously in healthcare sharing, and if you're a healthcare sharing member now, or maybe you've been one in the past, what you're probably used to is most healthcare sharing companies require their members to pay upfront first as a cash pay discount, and then take their medical bill and submit it to their health sharing company, and then wait to get reimbursed by the healthcare sharing company, which in many cases could take a long time and was a cumbersome process. Impact was the first healthcare sharing company that I know of personally where they invested the money into all the clearinghouses in the country. And what that means is, as a member, Impact looks and feels like traditional insurance. Meaning when you go to the doctor, all they have to do is put that EDI payer ID number into their billing system, and it allows them to bill Impact directly. What that means is, in most cases, our members do not have to pay up front as a cash pay discount. The provider just puts that payer ID number in their billing system and bills Impact directly. Now, for providers that are on the call today, what I'm about to say is music to your ears. Impact is processing and paying medical bills to you, the great providers of the world, in under 16 days' time on average, and they're paying fair market value, typically 130 to 160% of the Medicare rate. So for providers, as you know, this is very, very provider friendly. Now, I want to have full transparency with everybody on the call here today. See, what I described to you right now is how Impact is architected and designed to work. And in most cases, that's exactly how it's going to work. They put in that payer ID number, they bill Impact electronically, and it's awesome. In some cases, there's going to be what's called provider pushback. Now, why would that happen? Many people have never heard of Impact yet. Some people may have a prejudice because other healthcare sharing companies took a long time to pay them. So if you ever have what's called provider pushback, that's okay. And that can be normal. All you have to do is insist that they put in that EDI payer ID number. See, what I told a provider recently, I said, if you put in that EDI payer ID number, you'll see we're coded the same way as commercial insurance. They put that payer ID number in, they said, wow, you're right, we can bill them, this is great. And so if that happens, make sure they put that payer ID number in. Sometimes you might have to tell them that a couple times. And if there's still an issue, they can call that provider support line. Impact will tell them how much they pay, how quickly they pay. And for many providers, that's very exciting. If for any reason at that point, they still refuse to bill Impact electronically, here's the worst case scenario, guys. And again, I just want to have full transparency here. The worst case scenario is you can be treated just like any other healthcare sharing member. Hey, you know what? Just bill me as a cash pay discount. Give me the super bill. You submit that in your member center. Impact will reimburse you, the member, as quickly as they're paying their provider, as long as you've hit that PRA. If you haven't hit the PRA yet, Impact will apply it to that. That's the user experience with Impact. And look, Lauren talked about the repricing, the reference-based repricing. I want to share this story with you real quick. This is actually an employee of Lauren's husband's roofing company. Somebody that was one of the 40 million plus Americans that was opting out of healthcare costs previously because she just couldn't afford it. When they started offering Impact to their employees, she opted in. She took a plan that was $153 a month, and it had a $5,000 PRA. She said, this I can afford. And she became an Impact member. Shortly afterwards, she got into an accident, shattered her leg, had a $200,000 medical bill. Impact renegotiated that bill down to $20,172. Saved her right off the bat almost $180,000. But sharing now kicks in. Now, this was her first medical bill, so she had to pay her full PRA and that 10%. You could see her responsibility, $6,500 and change. The community shared in $13,600 of her bill. This was somebody that literally months before had no healthcare coverage at all. What if her employer didn't offer Impact to their employees? This is something that was an event that could have potentially bankrupted her. The last thing I want to just take 4 minutes and show you guys, and I'm going to get our guest speaker up, is I want to show you our member center. This is something that makes Impact stand apart night and day, anything that anybody's seen out there from a technology and a transparency standpoint in this industry. If I go to impacthealthsharing.com, first off, there's a lot of FAQs on there you can take a look at. I can log in right here, and now I'm in my member center. So when I log in, look, it shows that they just received the bill from my wife and I. That was our chiropractic adjustments. You can see there's a prayer request for Jeremy. I love the community. I love people contending for each other. I love people praying for each other. But I love how Impact allows you to see real time what's going on in your own membership. See, this is called decentralized reserves. Guys, think Uber, think Airbnb. Look, this is the future of healthcare. What you're seeing right now, this is decentralized reserves. This is the democratization of the healthcare system. Each of us as members have our own individually owned member account. Here's my account. Right now, there's $1,800 just sitting in my account. I can see the families I've recently shared. This all happens through technology. I don't do anything personally. The algorithm, the technology takes some from my account and other accounts and shares with other members. This is a community of people sharing in each other at their time of need. So I see I've shared in the Adams household, this FIDIX, the Sublet household. I could send these folks a prayer request. I can remain anonymous, but I love that I know where my money is going. Matter of fact, I can see where every dollar goes. I can see what's going towards the sharing community. I can see what's going towards the admin fees. I can see what's going towards program fees. We talked about we talked early on about the $100 health and wholeness credits. Check this out. This just started on July 1st. So here's for me personally. So again, our PRA is $2,500 a year for our family. Look, $399.35 of that has already been used. And that was just from a couple adjustments and 3 of those $100 health and wholeness credits. And I know we've got many members of the Drip Bar community on the call today. Welcome to you guys. I'm excited about the DFW Drip Bars giving Impact members a 10% discount. I love how Impact members have our health and wholeness partners giving additional benefits to members. But look, like let's say I go and I get an IV drip therapy, I can take that receipt, submit it in. That's going to be that $100 credit. There's so many ways that can be used. But let's look at the community here. I can see real time what's happening in the entire community. I can see what do they have in reserves. I can see how many members did they have? I can see the largest shares from last month, 46,000, 42,000, 37,000. I can see what they shared in last month in medical bills, just under $1 million. I can see how much they've shared over the last 12 months. And I can see how fast they're processing medical bills and how many bills are pending. Guys, all of us can see this real time. It's completely transparent. I love the pharmacy discount program too. You can look up pharmacy up prescription here. It competes all the local pharmacies against each other. It's just awesome. And for those of you that are wondering, well, I hear referral partner, how do I learn? Is there a business opportunity here? And the answer is yes. For those of you that want to learn more about the referral partner piece and the business opportunity to make residual income sharing with us with people, make sure you get back to the person who invited you on the call and say, hey, I want to learn more about the business opportunity part of this. And for those of you that are going to be with us in a couple weeks in Orlando at our national convention, the email just came out about selecting your vendor breakfast. And our next speaker, VP of Operations of Impact, Eileen Ryan, and President and CEO of Impact, Phil Chrysler, they're going to have a breakfast for all of us on Saturday morning. But that will go quickly. Last time there was over 350 people at the breakfast with seats and a bunch of people standing. So for those of you that are going to be joining us next month in Orlando, if you want to go to that breakout session with Eileen and Mr. Chrysler, make sure that you select that today. But look, I am so excited today to have the Vice President of Operations, somebody who has such a huge heart for helping people, and she's going to share with you some of the new exciting things happening with Impact and give you a little bit more of the history, the heart of this community that we're so passionate about. Eileen, thank you so much for being on today's call.
No, thank you for having me. Wow, Lauren and Jeff, every time I get on a call with you, I am just so impressed with how much you know about healthcare sharing and how willing you are to go out there and share that with others. But I want to also say cautionary to anybody who is new at Referring Impact, you don't need to know everything about Impact. That's what we are here for. So I take a deep breath. You don't need to ever get up to the level of Jeff and Lauren. You've got them every Tuesday and you've got us. Well, thanks so much for having me. What I want to talk to you first is about how Impact got started. About 5 years ago, our president and CEO, Mr. Phil Chrysler, and his wife, Angela Chrysler, very philanthropic. They owned a savings company. And what they did was they did a little research on healthcare sharing, and they were going to offer healthcare sharing to members of their savings company. And as they dove into the systemic problem of the high cost of health insurance in America and the issue with people having medical debt due to having medical bills not paid for by, this is not uninsured people. These are people who had medical, had insurance, yet these bills were not paid for. So they saw this was a big problem, big need, and they started Impact. It is a mission for them. They are on a crusade to help people bring this to market and let people know that there is an option out there to give them affordable health care that's comprehensive. And I would argue better than a lot of the health insurance plans out there. And let me tell you why. Jeff, you said that some of the other healthcare sharing organizations are about to have price increases. Well, we all know that insurance has had price increases. In 5 years, Impact has not raised their prices. That's very important to Phil. We say to Phil, are you sure? Maybe you want to. No. How can he do that? We're a not-for-profit. He keeps looking for ways to give back to the sharing community. And that's the beauty of being a not-for-profit healthcare sharing. So I think what would be easiest for me to do is just to take Lauren's example of that couple that she met. And they are a family of 4, and she quoted them $605 for a $2,500 annual PRA. Well, look at this, guys. Here's what they're going to get. Everybody in that family is going to get a free annual wellness check with labs. They are going to get unlimited telehealth with MD Live doctors. They are going to get comprehensive health care. If somebody needs, they have mental health challenges, they need chiropractic, God forbid they need cancer treatment, broken bones, surgery, anything that they need that is a new diagnosis, new injury, new accident, new illness, they will be shared, their medical bills will be shared by the sharing community. Now, Lauren, you pointed to the folks that have high blood pressure and high cholesterol. That's the two most common pre-X in the US today. Well, good news for those folks. If any one of these family of four are in that position and they're taking their medication, they're seeing a doctor annually and they're taking their medication, God forbid they were to have a heart attack or a stroke, the sharing community would pay for those eligible bills less a 10% co-share. So it's very robust. I can go on and on about how many other things, maternity, babies, neonatal, they need neonatal treatment. God forbid somebody needs to be airlifted. All of that, it's right there in our guidelines. Transparency, we're not for profit, we're transparent about what is eligible to be shared and what is not eligible to be shared. So back to that family of four. So they selected a $2,500 annual PRA. Well, part of being healthcare sharing community that's modern like Impact is we understand that there's a lot of people that want to be proactive about their health, which is why we have that annual wellness. They are into red light therapy, naturopathic, IV drip, vitamin therapy. They go to the gym. They want to have red light sauna treatments, cryotherapy. The list goes on and on. Anything that our members want to either take as a supplement or a treatment that they want to get that is for their health and wholeness, we're not judging it. They submit it. They get $100 a month credit to pay down that annual PRA. So you got a family of four. If you just submit your supplements, your vitamins that you're taking, your gym membership, your massage, you submit that every month. Now that family of four only has an annual PRA of $1,300. We've helped them pay that down by helping them stay healthy. We also understand that families have dental and vision needs. So we are adding next week, the emails will go out to all our members to enroll in the dental and vision discount program, which is not costing our members a penny. We have added that to give that as a perk to our members. So how does that affect that family? Now you've got kids who need orthodontics. By the way, it's veneers. I had LASIK. It's a LASIK. You get 30 to 60% discount at no cost. Our members will get for that. So that family of four, $605 a month, they are going to get comprehensive healthcare that runs the gamut from mental health to chiropractic to surgical cancer treatments, everything that you can think of. It is a comprehensive healthcare option. It's modern. We have technology that matches, as you saw, Jeff and Melissa have recently helped several families pay their bills. What does that mean? These members had eligible medical bills, and while Jeff and Melissa were sleeping, a little bit of money was pulled from their account to pay those members eligible bills. But guess what? It wasn't done in secret. They log in and they can see how they're helping their sharing community. We're also modern, not only in technology, but in mindset. Most healthcare sharing are religious-based, and you must sign something that says that you believe in that faith. We're modern alternative in that way, in that although we're based on the Christian principle of love thy neighbor, we accept people from every religious backgrounds, and we have people who are Jewish, who are Hindu, who are Buddhist, who are Catholic, Christian, and we're very, very proud of that. Why? Because as these folks told you, they're on a crusade, and we're on a crusade too. We want to deliver to the community at large something, let them know that there's something out there that's mainstream for them, that's affordable for them, and that they don't have to go the high premium, high deductible. I don't know if you're going to tell me my anesthesiologist was out of network and I'm going to end up with this bill type of plan. It's also portable. You can go anywhere in the country. You want to go to the Mayo Clinic, MD Anderson. I live here in Florida. If I wanted to go to MD Anderson, nobody's going to tell me no, because I can go and be treated anywhere in the country. We also, to the providers who are on the call, you'll understand this, we do not practice what's called utilization. If your doctor says you need a back surgery, then you need a back surgery. If it's a new injury, new illness that causes that new diagnosis, the need for that back surgery, then you're getting that back surgery. We don't say, no, you know what, why don't you go for 3 months to physical therapy and then we'll take care of that. So you've got the medical freedom. You can choose any provider that you want to see. We help you pay down your PRA. We're not for profit, we're affordable. We help you pay down your PRA by staying healthy. We are completely comprehensive. It's portable. And to the doctors who are on this call, I would encourage you to become what's called a preferred provider. Because you see those rates that they showed you, those outlandish rates, which don't even make me blink anymore when I see members' bills that are 200,000 that get repriced to 13,000. Those are hospitals that are doing that. That's not your provider in your community. The provider in the community is not charging 500, 2,000, 190% of Medicare. No. So we encourage you to submit the preferred provider form, and a member of our contracts team will reach out to you. They'll know what your codes are. They'll let you know what the rates are for your codes. And it's a very peaceful, like positive experience, because we want to welcome providers to become preferred providers with impact. So that not only helps the members in our membership community know that they can, support the providers in their community, but it helps the providers to know that Impact Healthcare Sharing is a good actor out there. Because as Jeff said earlier, sometimes, they don't know. A provider doesn't even know what healthcare sharing is. And you talked, Jeff, a little bit about pushback. I want to say that pushback, the majority of that pushback that you get will not come from, God forbid, you needed to go to the hospital. It's going to come from that small provider who doesn't, you go for your wellness check and they don't even know what Impact is. So we have an answer for that. Coming next month, we are going to launch a concierge service. We're so excited about it. And this will be phase 1 of more concierge services to come. But phase 1 is our members need to go have a wellness visit, which is their physical and labs, which is 100% paid for by the sharing community. They'll just contact us. We'll have a prompt in our phone line where they let us know, this is the provider I want to see. This is when I want to go. We will contact that provider, book that appointment for them, and pay for that appointment in advance. So all our member has to do to stay healthy is to show up and have their annual wellness visit. Once we launch that, we're going to then move on to adding the concierge service for, surgeries that people have upcoming with their knee replacements, hip replacements, things of that nature. So we're super excited about that, because you see, as a not-for-profit, we can continue to be adding things to the membership at no cost to our members to make it a better experience. And we're so excited to be able to do that. Next week, look for those emails that will come out for our existing members that will let you know, hey, complete this, and you can sign up your family for the dental and vision discount. And guys, there's no cost for it. It's not a sharing, it's a discount, but we've done business. I said that the founders of Impact used to own a savings company. We've done business with this company before. And when I tell you these are steep discounts on things like orthodontics and teeth whitening and braces and root canals and LASIK, it is something that you're going to go, wow. And it's seamless. You're going to log in, you're going to enter your zip code, and you're going to see all the providers in your area that are part of this dental and vision discount program. And if you have your favorite, eye doctor or dentist, and they're not a participant, there's a page there where they can be nominated to become a participant. Why would they want to do that? Because they get access to the tens of thousands of members who are part of this dental vision program. So we're so excited to bring all of this to you and to continue to add more and more to this membership without adding a price increase. All right. I know I haven't come up for air. I'm trying to be conscious of everyone's time, but I want to switch to the folks who are on the call, who are out there being the crusaders and talking to folks about Impact, letting them know there is this affordable, comprehensive option for them. Guys, we're going to be doing webinars for the next 4 months during open enrollment. Although here at Impact, we have open enrollment all year long. It's a great opportunity now between October 15th and January 15th to be having conversations with people, because they will be going into the Affordable Care Marketplace and shopping for insurance. And they're going to be paying astronomical amount of money with high deductibles, and they don't even know about this. So you want to have those conversations with them, and we're going to help you along with those conversations. We've got 4 upcoming webinars. They're going to be Monday nights at 8 p.m. The first one is October 21st. More information will be sent out about that. I also want to say, if there's anybody on the phone that on the call that has connections with hospitals where you know a contact person, we have a dedicated contracts person. Although we do not have a network, our members can go anywhere they want. If there's your favorite hospital in your community and you can get us the information of who we should contact, we have a contracts gal, and she is tenacious, and that's what she does all day long. And she'll contact them to help, get the ball rolling on getting contracts with them. So we've got a lot going on here at Impact. Open enrollment starts for the seniors October 15th. And if you've seen any of those commercials for seniors to get the Medicare Advantage, I was telling Jeff yesterday, I feel so badly for them because they think, oh my gosh, this is great, Medicare Advantage. No, what ends up happening with that is they're stuck. If they live here in Broward County, Florida, that's where they're staying. If they travel and go anywhere else and get sick or need to go to the hospital, that's going to be considered out of network, and they're going to be stuck with those medical bills. So you want to have the conversation with anybody who has Medicare A and B and is 65, let them know how affordable Impact is, that it's portable, they can go anywhere, including out of the country, right? So if you're out of the country, and like I just went on a trip, I bought travel insurance for the trip itself. But a lot of people buy travel insurance, like medical insurance, for God forbid something happens to them while they're overseas. I didn't have to buy that because, see, Impact, if you're out of the country and you have an emergency medical, you need emergency medical treatment, that is going to be eligible to be shared. So it's just phenomenal. How is it phenomenal? Because we're not for profit. Our only motivation is to help make this membership better and better for our members. And we're just excited to anybody on the call who's out there being a crusader to meet you in person. The whole Impact team will be there in Orlando at convention. And we're just committed to getting your questions answered. If you're not already registered, make sure you get registered for our training and come with your questions, because we want to support you, because you're out there being our brand advocates, and it's just our privilege to do so. So get enrolled, signed up for that. Providers on the call, get signed up as a preferred provider. We would love to have you on board. And we are just thankful for the opportunity to be on this call today. At least I am. Thanks, Jeff.
Well, Eileen, I am so excited about everything that's happening right now. You mentioned the concierge program. You said that's launching next month, meaning like October?
Yep.
So you guys are rolling out the dental and vision discount card and the concierge?
Yep.
That is amazing. And I just want to make sure everybody heard what Eileen said. You contact Impact, they will call and make your appointment, and they will prepay that appointment for you. Because remember, you get that annual wellness visit. And what I love about that is if the appointment is already paid for, there's zero possibility of you incurring that provider pushback that I talked about that sometimes happens. And some people say, how is this even possible that you guys are doing these things when everybody else is raising their rates? One thing I didn't mention before was that I know the goal of a good healthcare sharing company is to have 3 to 4 months of financial reserves. And if their reserves get less than that, they got to raise the rates. I know Impact is somewhere around 1 year of financial reserves, which is, I don't think ever happened before. And not only we're not raising rates, you guys are doing all these things as extra free member benefits for our members. I know there's a whole lot more planned for the future too. So we're so grateful for you being on here today, Eileen. And if we can bring Lauren back up on the screen here as well. And again, those of you that want to learn more about being a referral partner, about the business opportunity piece, make sure you get back to the person that invited you to the call and say, hey, look, I want to learn more about being a referral partner. For those of you that are like, hey, I really want to become an Impact member, remember, if you want your membership to begin on October 1st, you've got to complete that membership application. It only takes you about 15 minutes. There's no blood work required. There's no urine sample required. Nobody's going to come to your home. It's about a 15-minute process. You just have to complete it by 5:59 East Coast time on Monday, on the 30th, and then you'll be an Impact member as of October 1st. There's a $79 one-time application fee. You'll pay for that at the time of your of you signing up, and then you'll be a member with this Impact community October 1st. But Lauren, I know you and Melissa answered a bunch of questions in the chat. Was there any questions that you guys thought the whole community could benefit from that you want to either ask, that you want to ask Eileen or myself?
All I got was praise in my DM inbox here. Everyone was saying how great the call was. So I actually didn't get any questions, but Melissa, did you get any questions on your end?
Yes, a lot. But there's several that comes back to the same question, which is, what sets Impact Health Sharing apart from all the other health sharing organizations? Some people here have health sharing currently, but have worked with hospitals, or let's say the hospitals did not actually work with the patient and said that they do not accept health care sharing programs. What sets Impact apart?
Okay, so not only our modern, technology, but the fact that we are so member centric. If you are going to a hospital and it's for something that's emergent, it's illegal for them not to. You can go there even if you have no insurance or healthcare sharing. So we don't see that kind of pushback at hospitals. But if we did and somebody was there and having an emergency situation, we'll help them. But you just really just don't see that when it comes to hospitals. What we see with the hospitals are those $200,000 bills for a $13,000 service. And by the way, guess what they say? Your husband's, the employee who got that $200,000 bill, we repriced it to $13,000. They had to pay their 10% co-share and their $5,000 PRA, and then the sharing community paid the rest. Guess what the hospital says to that $13,000? Okay, thanks. Why? Because they knew it wasn't a $200,000 service. That just it's mind-boggling to anyone who is new to understanding, just how broken the healthcare system is. But it's not to us because we see those bills every day.
One cool story, Eileen, is, the only time I've really ever had provider pushback myself, I went to the dermatologist. I needed to get a mole removed. And they were like, oh, we don't, bill healthcare sharing. Okay, great, no problem. Look, do this. If they just wouldn't do it, like, perfect. Look, let me pay as a cash pay discount. I did. When I went back for my follow-up appointment, I went to go check out. I was like, okay, like, I'm here to pay. They go, oh, no, we owe you $150. Like, what do you mean? When we build that Impact Health Sharing company anyway, just to see what they did, we really liked what they did. They got back to us almost right away. So we owe you $150, and we will now work with any other Impact member moving forward. So just another again, the reason they said that, they told me, is that another health sharing company took a long time to pay them in the past.
Yeah, they don't have the technology, and but there's a lot of good actors out there. But I'm glad you brought that story up, Jeff, because the concierge service is we're starting out with the wellness visits, right? We're gonna make that call for you, make that appointment, pay that provider, but it also gives us an opportunity to develop a relationship with that provider and tell them who Impact is and encourage them to become a preferred provider so they get advertised in the member portal, and will get more Impact members, get more patients from the local community. And it just helps everybody. It helps our members, and it helps healthcare sharing in general. So we're so excited to be launching this, mostly for our members, to help you get those appointments, get those taken care of for you.
So excited about that. Melissa, what other questions?
All right, so let's go back to our seniors. two questions. Number one, is dental and vision discount card going to be provided for
Yes,
them?
it
And
is.
also, is the out of country emergency also available for our seniors?
So that's gonna be, so everything about the senior program is predicated on what Medicare says yes to. So like somebody asked me about hyperbaric chambers, right? Well, Medicare, I looked on their website and they will pay for hyperbaric chambers for certain diagnoses. So if Medicare pays the 80, Impact will pay the 20. So that's going to depend on if Medicare will pay for any of those medical bills outside the country. I just don't know the answer to that. So the senior program works a little different than the regular program. Medicare drives the bus and then we just, the sharing community pays the other 20% that they don't pay.
And just to make sure everybody heard Eileen's answer, the dental and vision program, yes, is also available for seniors. And to clarify, the $100 health and wholeness credit, that is just for members 65 years old and or under 65. The dental and vision is for everybody that's an Impact member. We're excited about that.
All right.
Also, I've got this question before, just over the phone and stuff, and people had asked if someone who's not an Impact member can take advantage of dental and vision, and the answer is no. You have to be an Impact member in order to receive that free dental and vision discount card.
Correct. That's a complimentary perk to our members. Hey guys, we got a question today because a lot of folks know people who live in Canada, and they asked if Canadian residents who live in Florida, you know, half the year, if they're able to get Impact, but they specifically asked about 65 and older. And so no, the answer to that for 65 and older would be no, because they have to have Medicare A and be 65 and older. But for anybody under 65, as long as they have a US bank account and a Canadian passport, they'll be fine. They can.
Awesome.
Right. So if a medical bill is repriced and the provider does not accept the reprice fee, is the member responsible for the balance over the repriced balance?
I love whoever asked that question. I love you. Great question. I told you that this is a mission for our president and CEO. Impact is a mission and bringing affordable healthcare. He has a personal stance. He will not allow any of our members to get a judgment against them. We have a legal team. We monitor those less than 2% of the time. Those large bills, we get pushback and less than 2%. And in those cases, after round one with legal, you know, we might say, okay, we're going to give you 20,000, not 13. They'll say, okay. And in less than 0.5%, they have to push back again. Legal has to go round and round with them again, but be assured, members, we will continue to go round and round with them until it gets resolved to your satisfaction and our satisfaction. We will not allow you to get a judgment. So no, to answer your question, we won't need them to however they do their write-offs or whatever, that's on them. We don't really care. That's not a factor. What we care about is having our legal team negotiate on your behalf and say, listen, this is 5,000% of Medicare. You can't justify this and we're not paying it. So let's take it down a notch. So we get very few of those, but what the important thing for you guys to know is Phil is committed. He's not letting anybody get a judgment. We'll keep up the fight and get it resolved for you.
I can speak on personal testimony of that really quick. One of my past ER visits, I received in the mail a summary of sharing from Impact saying, you know, this is what the bill was, it's a little over $4,000, and the negotiated price was $866. And the hospital didn't like that negotiated price, but I was told all I have to do is pay the hospital my $866, and Impact is going to dispute that on my behalf and, you know, take care of it. And so I'm happy. I got I'm all done, and I'm going to let Impact do what they do best. It was great.
Yep. We got a whole team for that. So I'm glad that worked out for you, Lauren, but yeah, we won't leave you hanging. That's important to Phil.
All right, so probably in the last 60 seconds, I've had 10 people message me. Where will they get information on the discount the discount card for dental and vision?
Yeah, great question. Right now, you might not have noticed it, but we put up a page last week called Perks. So when you go to impacthealthsharing.com, there's a little drop down there that has labs, prescriptions, perks, and it's got the health and wholeness credit page. That page for the dental vision will be live next week, but also every member is going to get an email and a link explaining to them what they have to do. They have to click on the link and they have to enroll themselves and their family members so that they will get their discount. This way they'll be enrolled with that company and they'll get their discount card in the mail so they can start, you know, going online and seeing what providers in their area are participating. So
One
they're
other
gonna get
question
email
that
and
I
the page
got,
will be up.
very excited to have everybody have access to that and to get those emails. And I've used the dental vision discount card for over a year now. Matter of fact, my dentist was the one that recommended to me. He was like, listen, like, you don't need to be paying what you're paying for dental and vision insurance. This will do so. This will be better for you. I paid just under $300 a year to have that dental and vision discount card. It ran out this month. I did not renew it. And what Impact's offering actually is more than what I was paying $300 a year for. Impact's giving me so much more and I'm paying nothing for it. So it's really awesome. But I already know the answer to this question, but somebody asked it in the chat and I'd love to just have you take it. How does maternity work with Impact?
Yeah, great question. So Jeff, you had mentioned before about, hey, you enroll, you want to start October 1st and that's it. You start right away. We'll start, you know, any eligible bills will be shared, right? It's not like with insurance, sometimes you have to wait 90 days before anything is going to be eligible. So that's that. Now, give me your question again. Take that chat off. I started reading the chat. Give me your question again.
Okay, so here
Jeff,
I got it for you. So the way that maternity works with Impact,
yeah,
everybody.
got it. Okay, so maternity. So that's the only one where we do have a 3-month waiting. So as long as the estimated due date is within the first 12 months. So to make that easy for you, you start in January, right? The first 3 months, you can't get pregnant January, February, March. After that, you know, April, May, June, July is your estimated due date. As long as it's on the 12th month or beyond, then it's eligible to be shared. So basically it's a 3-month waiting period. Even if you go into premature labor, you have the baby 2 months early, that estimated due date said, you know, that it would have been on the 12th month or after, that's going to be eligible to be shared. So it's just a little 3-minute, and that's fair. You know, that's reasonable. By the way, the baby's bills are totally separate. And from the mom and the baby, you just have to sign that baby up within 30 days, get them added, and the baby's bills are eligible to be shared right out the gate.
Also, I'll add
Melissa
to
and I-
like licensed midwives and doulas as well. You know, that all subject to PRA, but is shareable as well.
Yeah, that's listed in the guidelines. We love our transparency. Just go to Impact. It's right there.
Yeah, Melissa and I have a friend that just 2 months ago gave birth, has been an Impact member now for well over a year and went through the process with Impact. She actually was on the share list of the month on the bottom left. I called her like, hey, this is you, when we shared in her medical bills, which is pretty awesome. So
I thought one of our consultants was on your list that you and Melissa recently shared into one of their bills. And don't panic, anybody, you don't have to put, mine says Ryan family, right? Yours will say Street family, but you can just be anonymous. But I love the part of seeing who you're sharing and helping out in the community. That's really, it's powerful.
I got a question from Jamie, and we kind of already discussed it, but Eileen, maybe in your own words, the question was, how does one know what providers accept Impact Health? Not sure if people's areas, you know, will accept it. So I don't know if we've talked about like the EDI, the payer ID number and the provider support number, but if you want to touch on that.
Yeah, so what ends up happening is, like I said, you get that majority of pushback is with a small, like, okay, it happened to me, right? You got the girl at the front desk, I called to make my appointment, I've been going there 27 years, she looks in her little drop down, she doesn't see Impact, and she's like, oh, you're not in our network. You don't have a network, stop it. I know, I've been coming there 27 years. Here's what all you need to do is you need to enter our EDI payer ID number. So I had to like go through that little step to get that taken care of. Now that happened to be for my wellness visit, but we'll take care of that for you going forward with the concierge program. But Lauren, that is the other side of the coin to being able to go to any provider that you want. There's a lot of providers out there that Jeff's dermatologist, they don't know who Impact is. They've got their drop down loaded already with, you know, the top 10 insurance companies, and they don't have Impact listed. So that's going to take a conversation from the member to say, hey, listen, here's the EDI payer number. You just need to either enter this electronically or send it to the PO box, and the bill will be taken care of that way.
Awesome.
We
All right.
really, really appreciate your time today, Eileen. Can't wait to see you in Orlando. Again, for anybody that's going to be with us for the event next month, big convention next month that Impact will be at, that many of us will be a part of. Again, for those of you that are going to be there, make sure that if you want to be in that breakout room, it's going to be a town hall type discussion with Eileen and with Mr. Phil Chrysler. Make sure that you get that selected today because those spots will go quickly. So can't wait to see you in Orlando, and thank you so much for being on here on today's call. This call will be uploaded by tomorrow on the Facebook community for those of you that are part of the Facebook group. So you'll be able to go on there and watch the playback. You can tag other people on there so they can watch it as well. And we'll be back, myself, Lauren, Melissa, and the team next week to do another call similar to this next week, talking about and sharing the good news of Impact. So Eileen, thank you again so much. Lauren, do you want to just share that QR code one more time here for the Facebook group, and we'll wrap things up?
I just closed out of it, but if you guys type in Health Share Crusade Community, Health Share Crusade Community, it'll pop up, request to join, we'll accept you, and we'll post the recording by tomorrow. So thank you guys so much. Have a great rest of your day. God bless you guys. Thank you, Eileen.
God bless. Thank you. Bye.